Today we're talking about pain management, and if you have questions, please send them to the doctors at WLBT.com. And joining us today is Dr. Lori Marshall with PCA Pain Care Center. Thank you so much for being with us.
Thank you for having me.
Now, obviously this is a big problem for people. Tell us about pain management and why it's important.
Well, pain management is important because if pain impacts your life, it not just impacts you physically, it also can impact you emotionally and mentally, and it can affect your lives in ways other than just physiologically.
And we've actually had a question from Twitter, someone wanting to know, are there any new things, guidelines, diagnoses, treatment that you can use for fibromyalgia? It seems like we're hearing more and more people with fibromyalgia or those type of symptoms here lately.
Right. There are some new medications that are out there that are available for fibromyalgia, but the best treatment for fibromyalgia is to have a multimodal or multidisciplinary approach to help treat fibromyalgia.
And what does multimodal mean? That's a big word for this country girl.
Okay. Well, that means that you'll have medications that you can take, but also psychotherapy and behavior modification can help, and just helping you learn pain coping strategies so that your pain doesn't impact your daily life quite so much.
What are the most common areas that people have pain? Are we talking about back pain, shoulder pain, arms, or just full body pain?
Well, with back pain affects about 80% of Americans at some point in their life, and arthritis of the back or arthritis of the spine, degeneration, is a very prevalent problem, and there are ways to treat pain of the back or arthritis in the spine without necessarily being on medications or pain medications long term.
So it seems like we're hearing more and more people being on pain medication. Why is that?
Well, you know, as the population ages, you're starting to see more arthritis and degeneration in the spine. You have patients who have had back surgery, and the surgery has corrected the pathologic problem, but sometimes they still have pain post-operatively. And there are interventional therapies that are out there and that are available that can help treat pain without necessarily having to be tied to pain medications for the rest of your life.
Now, is it a good thing to constantly use, I know the few times I've had pain medicine, I couldn't function, so I couldn't imagine having to take it daily and then have to go to work, and they tell you not to drive or operate machinery using pain medication.
It does impact your daily lifestyle. They can make you sleepy. It can make it hard for you to concentrate and to function like you normally would on a daily basis, which is why the interventional therapies are a good idea. Some of the therapies can provide anywhere from 6 to 18 months of pain relief, and therefore you don't have to take the narcotic or opioid pain medications on a daily basis.
So tell us what y'all do there with that interventional pain.
Well, there are different types of injections that you can do in the back called epidural steroid injections. There are nerve blocks that you can do for the medial branch nerves or within the joints in the back that often get arthritis called the facet joints. If you've had back surgery before, spinal cord stimulation can also be an option.
So you're saying the same thing that we got when we had our babies?
Similar, except they're steroids instead of pain medication in there.
Okay.
It's a mixture of local anesthetic and steroids to help reduce the inflammation in the nerve roots.
Okay. Would there be problems with having getting the shots long-term when you're injecting steroids directly into your body like that?
Usually you'll recommend no more than about 6 injections in a 1-year period, and since you're getting the steroid dose directly at the site because you're going into the epidural space, you do have some of the risks that you have involved with steroid, like weight gain and so forth, but it's not as bad for you as taking steroids by mouth on a daily basis.
And what do your patients say after they have had this series of injections? They feel better?
They do. They feel better. You're able to taper down off of the pain medications in most instances. And sometimes you have to do a combination of injections because they have pathology in different areas.
I always think about the actress Kathleen Turner, who was absolutely gorgeous, did a lot of movies, had a fall and started getting some kind of injections. I don't know if they were steroids, and she said it completely changed the structure of her face. She looks completely different. Do people have that long-term getting the steroid shots, or is that just one of those cases where it was a fluke?
Well, you can get the weight gain, and so as you start to gain weight, it starts to change your facial features sometimes.
Wow. So what is the best option? What do you suggest for most patients who are dealing with pain?
I would definitely say give the interventional therapies an option, or give them a try so that you're not tied to pain medications long term. That would probably be the best thing for your body.
All right, tell us where you're located, where people can find you.
I am at PCA Pain Care Center. I'm located on Lakeland Drive at 1501 Lakeland Drive, and I also see patients at Baptist for Women on Tuesdays.
Very good. Well, thank you so much for being with us. We've been talking with Dr. Lori Marshall about pain management, and of course, for the latest health news anytime, you can always visit our website at WLBT.com and then click on Medical Matters.